Hello, my name is Kristen Smith. I'm an MSN student at University of San Francisco, and here is...
And hello, I'm Stefan Rowniak. I'm a nurse, a family nurse practitioner, and assistant professor here at the University of San Francisco.
Hello, Stefan. Thank you for taking the time to meet with me and host this interview. Can you please describe your nursing work and career over the years?
Certainly. My whole career trajectory really sort of paralleled the AIDS epidemic in the United States. That's when I began nursing school, just as AIDS was being mentioned. It was something that I thought was going to be very important and have big impact on the healthcare system. And many of my professors in nursing school thought, no, this is nothing. But I pursued it, and that has shaped everything I've done. My final year in nursing school, I worked at the first AIDS unit that was opened up at San Francisco General Hospital. And after that, I worked in an AIDS unit in a hospital and saw that what I really wanted to do was work outside the hospital and impact healthcare in the community. And so I became the AIDS Liaison public health nurse for the San Francisco Department of Public Health. And in that capacity, I began seeing IV drug users, sex workers, a transgender population, and poor people, people who really were disenfranchised from the healthcare system, that weren't being seen by many of the hospitals and other nursing facilities. And I worked in the Tenderloin in San Francisco for several years and decided I wanted to become a nurse practitioner. I wanted to increase my ability to impact the populations. So I became a nurse practitioner and had a little clinic in the Tenderloin for a couple of years, and then became part of the health department again. And I have been working for the past couple of decades at San Francisco City Clinic, which is the STD clinic, where my work has been working with HIV, STDs, reproductive health, and just sexual health in general. That led me to pursue some questions and get my PhD and do some research with the transgender population, and that's been sort of my work since then.
Great, I appreciate that. So how did you get to the current position here at USF?
My current position here, well, actually, that was very interesting because the way I got my PhD was it was an offer I couldn't refuse. There was a granting foundation that was offering fellowships. It was the Irene Betty Moore Foundation for nursing students, for people to go and get their PhD in nursing, and they would pay for 3 years of PhD education if you would promise to be a nursing instructor for 3 years afterwards. And I thought, well, I can do that. I'd like to do that. So I did that, and I got done with my PhD in 3 years, and I applied here because this was a school that was offering positions. I stated who I was and what my research was, and they said, please apply. Wow. I did, and I've actually more than fulfilled my 3 years obligation, and will maybe continue on longer.
How would you describe your leadership in the nursing or healthcare field, or both?
Well, to a great extent, my practice, research, and my teaching has been essentially to bring to the forefront disenfranchised populations, especially in my case, transgender population, to really bring awareness to healthcare providers on cultural competent care for a transgender population, and also to bring the whole notion of sexual health into nursing schools, how to do a proper sexual history, which is something that nursing really needs, and medicine in general needs.
What are the gaps in science that your research addresses?
Well, when I first began doing my research, I had to do a number of literature searches. And in fact, the reason I chose this topic was because essentially transgender care and the whole transgender population is a gap in the research. Mm-hmm. There's really not much there. Right. And so I saw that there was so much that we don't know, so much about a misunderstood population simply because we don't have information. We don't have good information. And so I essentially was the first person in my school of nursing in the PhD program to work on a transgender population. Since then, other people have followed suit, and we've got more going, but that was the gap.
And do you feel that this has been so significant and made an impact?
Slowly but surely, it's definitely making an impact. I've seen changes in the last 10 years, even, that are really, I think, are quite remarkable, and I'm very pleased with.
Great. So how does the state of your research and what you're doing currently and your work in healthcare relate to what is the current policy, either on the national or federal level?
Well, on the national level, we have health reform. That is one of the big issues, the most important issues with regard to policy around healthcare. And one of the most important things is making sure that those populations who have not been covered before, who have been outside of the healthcare system, really get into the healthcare system, get covered, and get competent, culturally competent care. And so I like to think that what I'm pushing and what I'm doing is completely in line with what our national priorities are. And I think they should be.
So, last question. What advice do you have for the next generation of nursing leaders?
I've worked with a number of nursing students, and I've found that I think one of the keys for being a nurse leader and being a good nurse is really understanding and working with what your passion is. Figuring out where in the healthcare your real desire and passion fits, and then just taking it as far as you can. Because nursing itself is so varied and so broad. There's so much that can be done within the realm of nursing and nursing leadership that there's something there for everyone's passion. And the challenge is to figure out what your passion is and go for it.
Great. Thank you so much for your time.
Thank you.